So we're all trying to figure out how to reopen and how to get back to school. Let me ask you this. I think the biggest issue on the schools front, which obviously has a huge economic impact, is how people feel not necessarily about the odds of children necessarily getting sick themselves, but to the extent that they're spreaders. We saw this study over the weekend, and we talked to Dr. Scott Gottlieb about it out in South Korea, 65,000 people they'd studied, that showed that kids over the age of 10 could spread it. It seemed to be inconclusive, or maybe, I don't know, you might have a different view about under 10. But what's your personal position now that on this issue, now that you've been studying it and looking at it so hard?
So thank you so much for that question. You know, the thing about COVID-19 is that it has really made it very clear that we are in a situation where science is important, and science, we're learning about this virus every single day. Here's the deal. We are learning that transmission is very likely to be about the same for children between the ages of 10 and 19 as transmission from adults to adults. We're dealing with an infectious disease, and here we have to be considering the basic factors of how do we break human-to-human transmission. Opening schools is going to require us to do the very best possible to protect children, students, and adults, family members and teachers. And it's going to require our following the science and updating what we do in practicing safe measures as we open schools and keep them open based on science.
So just to be clear, though, you would open schools?
You can't have one basic answer across the country because we have so much variability in community spread. In New York State, where transmission has been broken because of the implementation of public health practices, you could safely open schools. In places where the positivity rate for COVID is less than 5%, there are protocols that we could put into place that could safely open schools with the right social distancing, mask wearing, and the proper hygienes. In places where the population, the community spread is upwards of 25%, I would basically say do everything necessary to bring the community spread down, allow that spread to go down, and start to safely position students for re-engaging in learning with online learning until the positivity rate comes down to 5%. Right. This isn't rocket science.
Michelle, let me ask you. Right. Michelle, this is the governor of Missouri, Mike Parsons. This is what he said just yesterday to the St. Louis Post-Dispatch. He said, these kids have to get back to school. And if they do get COVID-19, which they will, he says, and they will when they go to school, that they're going to get it, they're not going to go to hospitals, he says. They're going to go home and they're going to get over it. Is that the right position to take?
No, it's not the right position. And I think the issue here, and we all have to understand this, is the science tells us that the likelihood of transmission from person to person begins with individuals not having social distancing. Kids do transmit the disease. This is not the kind of disease where it's only about the individual that's positive. It is about breaking the cycle of transmission to vulnerable individuals. And so I think the governor is missing the point that there's a shared responsibility here for us to practice public health measures that would break the transmission of the disease to the more vulnerable people. Look, we've got 141,000 people who have died from this disease. The transmission rates are high in certain places where we have to protect the vulnerable, those with pre-existing conditions and those who are at high risk, the elderly.
Right.